My name is Farm Francis, and this goes to the men. Don't take drugs just to improve sexual performance or impress women. Be confident in your natural body. If you're not sexually compatible with someone, just move on instead of forcing it. Avoid trying to fit in by using substances or altering yourself. What's reasonable in it? Some parts have a valid point. Avoiding drugs for sexual performance is good advice. Many can be harmful if misused. Self-acceptance and confidence are important. Not forcing relationships or sexual situations is healthy. What's problematic or misleading? However, a lot of the message is misinformed and harmful. It spreads body-shaming ideas about size, both men and women. It promotes false beliefs about women's bodies, e.g. that someone becomes unsatisfiable based on past experiences. That's not medically true. It uses disrespectful language and stereotypes. It frames relationships in a very judgmental and one-sided way. A healthier, factual perspective. Sexual satisfaction is not just about size. Communication, emotional connection, and technique matter far more. Women's bodies do not permanently change in the way described. Taking drugs for enhancement, without medical advice, can be risky, but seeking help for sexual health is normal and okay. Healthy relationships are based on mutual respect, consent, and understanding, not comparison or pressure. Bottom line. The core message, don't rely on drugs and be yourself, is good, but it's wrapped in toxic, inaccurate, and disrespectful ideas. To explain it further, 1. Does size really matter? Short answer, not as much as people think. The average penis size when erect is about 12 to 16 centimeters, 5 to 6 inches. The most sensitive part of the female body for pleasure is the clitoris, which is outside and near the entrance, not deep inside. The vaginal canal is usually about 7 to 10 centimeters deep when not aroused and expands during arousal. This means very large size is not necessary for satisfaction. In fact, too large can cause pain or discomfort. Skill, communication, and emotional connection matter far more. 2. What actually leads to sexual satisfaction? It's not just physical. It's a mix of things. Key factors, communication, knowing what your partner likes, foreplay, very important, especially for women, emotional comfort and trust confidence, not arrogance. Understanding your partner's body. Studies consistently show that many women do not orgasm from penetration alone. External stimulation, like the clitoris, plays a major role. 3. Do women become loose or hard to satisfy? No, that's a myth. The vagina is elastic. It stretches and returns to shape. It does not permanently change because of number of partners, sex frequency, use of objects. The only real factors that may affect tightness are childbirth, temporarily and often recovers, muscle tone, which can be improved with Kegel exercises, so the claim in the image is scientifically false. 4. What about drugs for sexual performance? There are two sides. Legitimate medical help. Drugs like sildenafil, Viagra are used for erectile dysfunction. They are safe if prescribed by a doctor. Misuse, taking drugs just to impress or compete, can cause dependence, lead to side effects, headaches, heart issues, increase anxiety and pressure. Better alternatives, exercise, good sleep, reduce stress, healthy diet. These naturally improve performance. 5. The biggest factor, your mindset. Performance anxiety is one of the most common issues in men if you compare yourself to others. Worry about size. Try to prove something. It actually reduces performance. Confidence comes from accepting your body, focusing on connection, not competition. Final truth, simple and real, sex is not a competition. Size is not the main factor. Women are not damaged by experience. Drugs are not a shortcut to confidence. The best lovers are those who listen, learn, respect their partner.